Hi there. This video is to look at particularly the HbA1c folder in our reports for pathology. If you've not already watched the kind of more generic introduction, I would recommend starting with that. We're not covering everything to do with HbA1c in this video, just sort of highlighting some of the points of difference with some of the other modules. So as normal, we've got this admin section. It's worth noting that this particular one, generating a care plan, is not essential. Some practices have got enhanced services to do that. It might be something you want to think about doing for patients who are well controlled, but that is not something that you've got to do to be sort of safely running the module. These ones here about running protocols and things should reflect your practice setup. If you've got all the automations turned on, you're unlikely to have anyone in here, depending again on how you're sort of decided to flow with patients being referred to the diabetes prevention program. Clinical review, this is the sort of most chunky bit of it, and the two most significant ones really are these two. So diabetes poorly controlled and risk of hypos. These others are slightly sort of softer and less critical to review. Certainly these ones here. There are options in terms of how these get directed. You can have all of these directed to an appointment or just these two. That's if you're always wanting them to go to an appointment. The steroid-induced diabetes, again, you may not have any patients in there. That one is important to track. This one here, NDH, if patients are over 80, they generally shouldn't be referred to diabetes prevention program unless someone's reviewed it and thinks that it's appropriate. So there's an alert on the HbA1c page to kind of use to record the outcome there. Diagnoses. So this one particularly can be automated if you want. That's probably why we've got no patients in there. And that's where essentially it's appropriate for sort of bulk or automated coding. But there are some where it might be steroid induced, and so it needs a bit more of a careful look. Again, I would say this one is the most critical. So that's where really there is a confirmed diabetes diagnosis. These other ones are lower priority. So either potentially a patient who's no longer in remission from diabetes or is in remission. As you may well know, from a QOF point of view, and so from the recall point of view, a patient being in remission doesn't actually change the QOF requirements or those sort of disease processes. Obviously, we want to try and keep diagnoses up to date. But yeah, the most important one is this one. This one here as well, just to explain, if a patient's had a one-off HbA1c over 48 or above, and doesn't have a diabetic diagnosis, the recall module would already be sort of in the process of then inviting them to come and have it repeated. There's also a message that can be auto-sent that says to the patient, your diabetes screening test is raised and needs repeating. But if it's very raised, then it may be that they're symptomatic, and actually it's appropriate to diagnose from just the one reading. It's not critical to keep sort of reviewing that one because patients will still have the repeat anyway. But again, it might be a useful one. This referral section, again, is one that you may not need at all. It's really there for some practices who kind of don't provide care for those who are insulin controlled or have kind of funding restrictions on some of those things, and so they are routinely referring patients for some of these reasons. If you're not kind of regularly referring patients in certain cohorts to either secondary care or sort of community DSNs, I wouldn't expect you to use that. This one, though, is a little bit different. So that's a new diabetes diagnosis with no diabetes education referral on or since. That might be because it's been discussed but not coded properly, or it might be because they've been diagnosed but they've not responded to invites to be booked in. But yeah, the other ones in that section are not so critical. Other than that, the rest is all fairly standard and matches the same as the other modules. I'll do a separate video for the HbA1c template But I hope that helps you understand some of the nuances within this page. Thanks.